Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Post-op urinary retention when you can't pee after surgery. Urinary retention and complete inability to urinate can occur after surgery and may be chronic or acute. Symptoms include discomfort in the bladder area, lower abdominal pain, trouble starting to pee, or being unable to pee even though you have a full bladder and feel the need to. The condition may be caused by anesthesia, post-surgery medication, or certain types of surgery. /r/n/r/n If you can't pee at all, it is important to seek treatment right away. Similarly, talk to your healthcare provider if you are able to pee but feel like you still have urine in your bladder afterward. Urinary retention usually gets better after a few weeks, but proper care is important to avoid damage to your bladder, including rupture, in rare cases, and kidneys. /r/n/r/n illustration by Emily Roberts for Verywell Health /r/n/r/n If you are unable to pee, you may have acute, sudden and serious, or chronic, ongoing, retention. Both types of retention can occur after surgery. /r/n/r/n Signs of acute retention include /r/n/r/n Not all people who have had surgery experience these symptoms. If you've had surgery, it's important that you pay attention to whether you need to pee and how often. /r/n/r/n You should be able to urinate within about 7 hours following surgery, although it may happen sooner. At this point, anesthesia should no longer affect your ability to pee. /r/n/r/n Unlike acute retention, which means you cannot empty your bladder at all, chronic retention refers to other types of problems you may have. Symptoms of chronic retention include /r/n/r/n This type of retention is not always a medical emergency. However, people who retain urine even after peeing, called post-void residual urine, are at a greater risk of urinary tract infections, which can cause serious complications. /r/n/r/n Few people experience urinary retention that lasts longer than 4 weeks after surgery. In most cases, it resolves on its own in 4 to 6 weeks. /r/n/r/n It may seem like a simple process, but emptying your bladder, called micturition, is complicated. Muscles, nerves, and the spinal cord all work together for urination. Sometimes, major surgery can temporarily impact one or more parts of the process. In fact, having trouble peeing after an operation is fairly common. /r/n/r/n How quickly you can pee after surgery is usually based on a few things. /r/n/r/n It's extremely rare, but sometimes a surgical error such as accidentally cutting one of the tubes that transport urine may be the reason you can't pee. This complication is typically detected before you leave the hospital. /r/n/r/n Post-operative urinary retention is common in certain groups or with procedures. For example, up to 24% of women experience some difficulty after surgeries for urinary incontinence or a pelvic organ prolapse. The incidence can be as high as 43% after tension-free transvaginal mesh sling placement. /r/n/r/n Other risk factors include /r/n/r/n One older study cites lower body index as a risk factor for postoperative urinary incontinence. However, more recent studies do not list body mass index, higher or lower BMI, as a risk factor. /r/n/r/n At least one older source states that being female is a risk factor, while newer sources state that the condition is more common in men. /r/n/r/n Some underlying conditions that can lead to urinary retention include neurological disorders like Parkinson's and Alzheimer's disease. /r/n/r/n Talk to your healthcare provider before your surgery about the medications you are taking and whether you have any existing conditions that impact your ability to pee. If you have an enlarged prostate, for instance, surgery could make your symptoms worse. Certain medications like antidepressants, antihistamines, anti-anxiety drugs, and anticholinergic medications can affect your bladder function. /r/n/r/n During surgery, a urinary catheter may be inserted to allow the bladder to fill and drain normally. Depending on the type of procedure performed and how long you're expected to be in the hospital, you may still have the catheter in place when you wake up. Not all people will have a catheter during surgery. /r/n/r/n However, if you can't pee after surgery, a urinary catheter is the best treatment for a full bladder that does not respond to repeated attempts to urinate. Your healthcare provider may recommend a catheter, even if you didn't need one during your procedure. This will help you avoid the damage to your bladder and kidneys that an overly full bladder can cause. /r/n/r/n Some people will need short-term catheterization in the hospital, but others may need to use a catheter for a while after they go home. They may be taught by medical staff how to self-catheterize so the bladder can be drained as needed should the problem occur repeatedly. /r/n/r/n Your healthcare provider may also start you on medication to relax your urethra to make it easier for your bladder to empty. This medication, called an alpha blocker, is often given to men to relax the prostate. It can also be given for a short time period to men and women to help them urinate after surgery. /r/n/r/n Other interventions can include acupuncture, massage, and the use of warm compresses. /r/n/r/n Signs that you should seek medical help vary slightly depending on whether or not you have a catheter. You should also look for signs of an infection. /r/n/r/n If you do not have a catheter in place, reach out to your provider. If /r/n/r/n If you do have a catheter in place, reach out to your provider. If /r/n/r/n You should also call your provider if you notice any signs of a urinary tract infection. Symptoms include /r/n/r/n If you're having trouble urinating after surgery, here are a few strategies that may work. /r/n/r/n Not being able to pee normally after surgery is common. It varies from person to person, but most people resume normal urinary function within a few weeks of surgery. /r/n/r/n Until you can pee normally, certain interventions may help. A catheter will drain your bladder to limit any damage from it being too full. Medications may help, as can alternative treatments like acupuncture or warm compresses. /r/n/r/n You should be emptying your bladder numerous times a day. If urinary retention persists beyond the recovery period, your surgeon or family healthcare provider may order additional tests to determine what is causing the problem and the best course of treatment. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.